Hi televiewers, you're welcome to Inside the Health World on Hi Television. It's a pleasure to be with you this afternoon to talk about health. Health is something that I will always advise everybody. When you see a health program, it's good for you to sit and watch. Even call your friends, your neighbors to be part of it, because you might just be healed or treated through what you get from our health program. And we are here on Hi Television. Today we are to discuss something very important. Our topic for today is protection and prevention of communicable diseases. We are going to learn what are communicable diseases and see how we can protect ourselves and prevent it so that we don't fall sick. So that's our topic for today. Bringing to you our guest, we have Dam Jim Amina. It's a pleasure to have you on the program. Oh, you're welcome. We also have Ndime Joycelyn. Pleasure to have you again.
Thank you.
We also have Cho Tu Winner. Pleasure to have you. And to crown the set, we have Iya Faith. You're welcome to the program. All of them are from the University of Buea Nursing Student Association. You can see that these are students who are still going to school, like I said the other time, but they know their social responsibility of giving back to the society, educating the society on certain issues. So I will start with you, Amina. First of all, we are talking about prevention from and protection and prevention from communicable diseases. Can you tell us what is it all about?
Okay, so communicable diseases are infectious diseases that are being transmitted from one person to another, and are mostly caused by bacterial infections, viruses, and other pathogens around. So examples of these communicable diseases, I'll start with the ones that are most common in our society. So we have the HIV and AIDS, we have syphilis, gonorrhea, chlamydia, we have TB, we have malaria, cholera. Yeah. So these diseases are mostly transmitted through direct contact. Like you have direct or physical contact with someone who is so if you come in contact with contaminated water, they are likely to pick up this. For instance, cholera. If you drink contaminated water, you will pick up cholera. So we also have vector-borne. For instance, the malaria. Malaria is everywhere now. So if the female Anopheles mosquito bites you and it's infected, you are likely going to pick up malaria.
All right, thank you. Let me also come to you, Iya Faith. We are talking about communicable diseases, to see how we can protect and preventing ourselves from them. So, what do you have for us?
The first thing I will talk about preventing communicable diseases is by getting vaccinated. Now, vaccination is one of the most effective ways of preventing these communicable diseases, and they help to stimulate the immune system, which will help to fight against specific pathogens causing these diseases. The second thing is you talk about proper hygiene, proper hand hygiene. You should wash your hands with soap and running water. Specify running tap water. You should not use water that is stagnant in a bowl that will be kept for days. So you should use running tap water with soap. Wash your hand for about 20 seconds. And if you're in a situation where you cannot be able to get water and soap, you could use your alcohol hand-based sanitizer. Another way to prevent is respiratory hygiene. That's another way of preventing these communicable diseases. Because for people that are infected with these communicable diseases, and they tend to sneeze or cough. So one way you can use to prevent yourself, if you have a tissue, you could use to cover your nose, you could use to cover your mouth, because these respiratory diseases, the communicable diseases that are gotten through respiratory infection is they are spread through air droplets. So you use a tissue, you can cover your face and your mouth, and immediately you're done, you properly dispose of this tissue and you wash your hands, same with water and soap. You don't have to use your sanitizer. Another way to prevent from having this communicable disease is proper food handling. You should ensure that before you eat your food, be it whatsoever, before you're cooking, you should wash them. Even fruits, it's advisable that you wash them before eating, because you don't know the method of preservation and even transportation before you had to buy them. So you ensure that you wash them before eating. Also, before eating, after eating, you wash your hand. After visiting the toilet, you ensure that you wash your hand. Another way of preventing is safe water and sanitation. You ensure that you drink clean and potable water. You know that good water does not have smell, it does not have taste, it does not have any color. So you make sure you drink good water, and by drinking so, you are able to prevent things like cholera, because a way of getting cholera is by drinking contaminated water. Another way of protecting yourself from these communicable diseases is by practicing having safe sexual practices. Because if you sleep with somebody that is infected, let's say HIV, you will get it. Somebody with hepatitis B, you will get it, because they are being spread through sexual intercourse from the vaginal secretions and also the semen deposition. You can get them. So you can use condoms if you know that you have to undergo sexual intercourse. You can use condoms. That is a method of prevention. Or better still, abstinence. Just abstain, stay away from sex, and you avoid multiple sexual partners. Because you have these multiple sexual partners, you are not sure of your partner status, but you go around sleeping from one person to the other. So to prevent it, you can use your condom as a method of preservative. And also with your partners, you should always have an open and honest conversation with them. They should tell you about their health status. They should tell you that, okay, from time to time, I've been to the hospital, this were the tests I did, I am positive, I am negative on this. Another way of preventing communicable diseases is by what we are doing now, community awareness. If people are actually aware of what communicable diseases are, they'll be able to prevent these things. So we should engage in telling the community, let the community be aware that these are the things that they don't have to do, these are the things they have to do to prevent and stay away from it. Another way is vector control. We know that malaria is being transmitted when the female Anopheles mosquito that has the parasite bites and infects another person. So if we can do something like vector control in the sense that we know our surroundings, where we live, and we know we don't have to keep stagnant water, because these are breeding sites for mosquitoes. So we can drain all standing water. You sleep under treated mosquito nets, you are able to prevent malaria from that, and also avoid any dirt in the compound. So ensuring this vector control is another good means, effective means of preventing these communicable diseases. Also, with people that you see that are infected, you should avoid close contact with them. You not really get contact with them. Ensure that you're also covered, because somebody with, let's say for example, tuberculosis, one way you can protect yourself is by having a face mask on. Do not talk to the person directly, because TB is spread through air droplets. So you protect yourself first by having the face mask on. And also people with other diseases who are sneezing and coughing, you know, you have to be around them. You also tell them also they don't have to spread this disease, so they can always have a tissue, handkerchief. They should ensure that they cover their, if they don't have, they can use their elbows, and immediately they are done, they discard those things properly and wash their hands immediately, because we don't want to spread and touch other places. Also, we're doing something of health education. This is another way. We can go into schools to educate people, let the community be aware that these are ways that they can get these diseases. They should be aware of the risk factors, how people are being exposed to it, and the type of consequences that come with it. Yes.
Well, thank you very much. Yeah, Faith. Okay, let me come to you, Jocelyn, our Miss, right?
Yes.
Okay. So tell us, what did you prepare for us as per the topic?
She has said almost everything.
No, maybe somebody might say something, but you say it differently and somebody understands. Okay, yeah.
Let me emphasize on malaria.
Yes.
Malaria is very common in our society nowadays, and some of us are the causes of this disease. If you go to our neighborhoods, you will see there is dirt everywhere,
of course,
stagnant water, people throwing, like, they don't close their windows, bushes behind your houses, it's all grown. So we have to prevent this disease. And also, now in our hospitals, they are giving vaccines to children at birth. Vaccine for malaria.
Yes, it's out. Yeah, it has been introduced.
We We have a vaccine for malaria. So mothers, please, if your child has not received it, she should.
The issue is that the vaccine is not it's just the three district areas. We have Manfe, we have Limbe, and we have Tiko. The reason is because those are the areas that if they want to carry out statistics, they will see that a lot of children die of malaria because of cost and everything. So those are just the areas that they are handling for the moment here in the southwest region.
Alright, so let's just keep that on the side. Those that can access the truth. Okay, so let's learn how to clear the bushes near our houses, drain all standing waters, because that's where the larva of the mosquito, that's where they breed. Yeah, so we need to learn how to drain them all out. Sleep under mosquito nets. Most people are scared of it because they feel like they're in a coffin, stuff like that, but it's really important. Yeah, some say it gives heat and stuff, but it's really important for us to sleep under those. And let's learn how to close our windows by 5 p.m. to prevent those mosquitoes from entering the house.
All right, Rina, I'm coming to you. We are talking about how to protect ourselves from communicable diseases, how to prevent it. What do you have for us?
Okay, thank you very much, ma'am. Communicable diseases, yes, we have seen the prevention, but what are the causes? Now, there are various causes of communicable diseases. Firstly, we have bacteria. Bacteria are single-celled organisms which cause these diseases. Yeah, some examples of these bacteria could be tuberculosis or urinary tract infections or strep throat. Then we have viruses. These are smaller organisms, microorganisms, which are even smaller than bacteria in itself. Viruses cause diseases such as the HIV, and it's not easy to. In fact, they don't have a cure. And then we have parasites such as the malaria parasite, and then we have other parasites such as intestinal worms, and we have fungi which cause many skin diseases such as outlet foot, also known as water rain and ringworm. Yeah, so those are the causes of communicable diseases.
Okay, I just learned, I'm coming to you, Amina. She just talked about prevention, but when you look at the communicable diseases, we have so many of them different. Is it that there is a way to, let me say, how can I put it, a uniform way to prevent these diseases, or each one has its own way of prevention?
Thank you so much for that question. Each of these diseases have their different ways by which we can prevent them, because some of them are caused by viruses, others are caused by bacteria, so we cannot prevent them the same way. For instance, okay, let me just streamline back to taking particular case studies. So we have HIV. HIV is something that at first there was a very common myth, like, okay, you have HIV, the next thing is that you are going to die. But thank God, thank sciences, we are getting more light on that. And nowadays, if you get HIV, you can actually live a normal life. You can actually live like every other person, as long as you go by your medications that are prescribed, like you correctly follow your medications as the doctor prescribed. You are going to be okay. You are going to, even though you will still have the disease in you, but your viral load is going to be reduced in a way that you might not be able to even transmit it to another person. So even you can actually live a normal life. You can get married, have children that are free, and your partner is free. It's just for you to go to the hospital, especially when it's still at the level of HIV, has not yet gotten to it. So you can actually go to the hospital, and when you are diagnosed of it, you follow your medications, go for follow-up and all of that. So you are going to be okay. You give birth to your child, and the child is HIV free, or your partner too is HIV free, as long as you adhere to your medications.
All right, so one of the ways to protect ourselves, to protect our loved ones when it comes to HIV, go to the hospital, so they give you your antiretroviral drugs to prevent you from all of that. Okay, I'm coming back to you, my dear. I want us to talk a bit, because malaria is something that is really a problem, especially in this in Africa, some countries in Africa. And thank God there is a vaccine now. even though we don't, not every area in the southwest region has access to it now. But let's look at the preventive methods. You just talked about keeping your surrounding clean and all of that, sleeping under mosquito nets. We have children, even newborn babies, they do suffer from malaria. How do you explain, or how will you advise mothers to take care of these children to make sure that they prevent them from even having the malaria in the first place?
Okay, thank you so much for that question. First of all, these mothers have to know that where the children sleep matters a lot. So they should not only ensure that they are sleeping under mosquito nets, well-treated mosquito nets. You don't take anyone that has stayed in the house for long, is dusty. And also, these children can use anti-repellents. Their parents can use anti-repellents at home because they can even spray the houses. They close everywhere, they spray the houses there for some time, then they get back into the homes. You kill the ones that have gotten into the house, because if you're not able to close the windows by that 5 p.m., probably some may have gotten in. So you can use those anti-repellents at home to spray. And there are even anti-repellents that you rub on your body. There are body creams. Yes, when you rub them on your body, they're not able to bite you. And also in places where malaria is really endemic, they can also put in long clothing. Children can put on long clothing, pullovers, long sweaters, socks, and long trousers to prevent themselves from being beaten. And you cannot be living in a dirty environment. If you notice your compound is overgrown with bushes, you should clean them up. They should not come and tell you are waiting at the start of every morning. There's a general cleanup you do. Immediately you notice that there are grass, there are bushes around you, clean them. Yes, any standing water you drain, the gutter should be well kept clean as well, because all these places are breeding sites for mosquitoes. Yes, so your environment is one important place where you live that you can be able to prevent these communicable diseases. Yes.
Okay, Jocelyn, let's talk about airborne diseases, because like you said, this the Apollo, how do they even call it? That's how we call it in conjunctivitis. All right, it was so common, the flu and everything. How can we prevent these ones? Because these are things that are so common. I remember it's conjunctivitis and airborne disease also. Yes. Yeah, it was almost everywhere in the household. You have from the father to the children. So how can we prevent them?
Okay, airborne diseases. Examples, we have the influenza. We also have COVID. COVID is an airborne disease.
Yeah.
Okay, ways of preventing it is like when we are coughing, for those who have cough, especially tuberculosis, when you're coughing, you do this. You cough in your elbow. Or if you cannot do that, you use a tissue and cover your mouth and your nose. And after doing that, you throw it away. And make sure to wash your hands or you sanitize. And also, let's avoid touching surfaces and then just touching your mouth or your nose, because those are the passageways. That's where they pass through to get into your body. So if you're in a public place and you don't really know how safe that place is, when you finish, avoid touching your nose and your mouth. Wash your hands. Always, like, let's practice hand hygiene. And if you cannot have ways to wash our hands always like that, we can just work with our sanitizers. You can sanitize your hands for like 10 to 15 minutes always. Those are ways we can prevent airborne diseases.
Okay, I'm coming back to you, Amina. I want us to talk about this tuberculosis. I used to see when people are suffering from tuberculosis, they isolate them, they keep them in isolation and all of that, and it kind of stigmatizes them in one way or the other. How can people really prevent themselves from having this tuberculosis?
Okay, tuberculosis, it's an airborne disease to begin with. So once you are beside someone who is infected, you are already at risk of being infected as well. So the most you can do is to put on your face mask always. COVID came and taught us and we were forced to always put on face mask. So you can always put on your face mask, not just for COVID. People have this myth that it's only for COVID. No, it's for airborne diseases as a whole and many other things. Just covering your nostrils with a face mask or a face shield is going to go a long way. And avoid touching surfaces and just take your hand to your face directly or something, or to your mouth. No. If you touch a surface, you can wash your hands after that, no matter the surface, because you are not so certain of the bacteria that is on that surface. Because somebody can just pass here and cough and you think it's ordinary cough, not knowing that the person has TB. So when you touch surfaces, or before you put something in your mouth or touch your face, it's always advisable to wash your hands. Or if you cannot access water at that particular point, you use your hand sanitizer and just sanitize your hand before you can do any other thing. And coming back to the part where people are isolated, if you have TB and they're isolating you, first of all, is for the good of the people that are around you. As a healthcare personnel, I don't want to take care of you and I get infected, because the next time maybe someone else comes, there will be nobody to take care of the person. So yeah, isolating you is just a form of protecting others that are around you, protecting the disease from moving around or from spreading to others around you. Sometimes they even restrict you from having visitors and all of that. It's just to protect them. So it's not, they're not isolating you because we hate you or some kind of myth that goes around. It's just for protection. Yeah.
Another common thing, and most especially with the young people, is this the sexual transmitted diseases. I'm coming to you now, Winner. You know, most people, most young girls and young girls, when they go into this sexual intercourse or sexual practices, if they are protecting themselves or putting on a condom, is because they don't want to get pregnant. What they prevent is pregnancy, forgetting that they can contract one or two kind of diseases. So I just wish you to look at, let's look at it, the preventive methods. Is it just by putting on condom, or not to venture into it at all? I think that is the best preventive measure.
Actually, Mario said it all. Abstinence is in fact the safest means in which, for your own benefit of doubt and for everything, just stay away. And also you could get vaccinated. For example, hepatitis B. There is the Hep B vaccine for it. So you could get vaccinated to prevent those stuff, to prevent infection and every other wahala which may come behind it. Also, education. You need it's good to be educated about it. You need to find out, for you to know more about sexually transmissible infections. Most people don't care. They have no knowledge about it. They just know, okay, there are sexually transmissible infections. Some people don't even believe they exist.
Wow.
Like HIV.
In this generation.
Some people don't even, yes, some people don't even, they feel like, okay, I'm the lucky one, I cannot get infected with HIV and anymore. They don't even know the types of infections which are there, sexually transmissible. So education is very important, abstinence and protection, the condom and all you said. Vaccination, very important.
Yes, thank God you just mentioned vaccine, because I know that one of the easiest and most effective way of preventing any disease is through vaccine. But we all know that not all of these diseases do have vaccines, right? We have some that have and some that don't have. So it's important that you follow the measures that are being given here to prevent all of these things. We're talking about virus, we're talking about bacteria. I mean, this virus and bacteria, do we see them? Can we really, like this thing is here like this, I see, hey, this is a virus, and I really run away from it so I don't get infected?
I think if they were visible, then they will not be here, will not be here to make people aware of these things, because everybody wants to stay away, everybody wants to run away from them. Of course, they are very minute and microscopic, so much so that we cannot even see them. We can only see them through under an electron microscope. Yeah, so just like they used to say, just suspect every surface, suspect everybody. Like if you are not just
everybody is a suspect.
Yeah, everybody is a suspect. Don't suspect that this person is working and this person might be carrying this virus or this bacteria, so that you be able to protect yourself. Because if you see everywhere as being clean, even if you clean this surface, it's not clean. If they use a microscope to show you the things that are there, you might be walking and hanging your hands not to touch anything at all. So that everywhere they are so numerous, like there are so many of them out there, on surfaces, in the air, in water, on the ground, everywhere. So it's just for us to.
Okay, Jocelyn, one of the places that people usually get infected with some of these diseases restaurants where people sell food, where people go and eat, people can develop cholera. Yes, and how can those that are the owners of these restaurants and even those that are going there to eat make sure that you don't go to somewhere, maybe you are hungry, you go to somewhere to find food and eat, end up getting sick, falling sick, and spending more money in the hospitals?
Okay, thank you for that question. Firstly, the people who own the restaurants, we are not sure of their sanitation methods. Yeah, there are places like Douala where there are some areas where there is no water. People carry water from pathetic places, and since they are selling, they don't care. Their aim is to make money, so they just cook, and they don't even cook it well. Yeah, so these microorganisms are still in the food, and even the water that they give you to drink, we are not sure is even portable to drink. So I advise that if you are going to a restaurant to eat, first check the sanitation of that restaurant. Not all of them are clean, so you need to put that in mind. You eat in a healthy environment. Yes, make sure like the places are clean, the environment is clean, and the owners of the restaurant, let's try to like make it clean so that we don't have flies, vectors who carry these pathogens and then just drop them all around. Yeah, so please let's just have conscience to serve people with clean water, wash plates with clean water. Yes.
Thank you, because I know that most of the times you go to eat somewhere and you look at the water that they are using to wash plates. It's just if you're in your right senses, I believe you will just move from there. But you see some people, because of hunger and maybe I don't care attitude, they don't care about their health, they still sit there to eat. Restaurants owners, you people should make sure that what you serve out there to people should be food and not diseases, because people come to buy food. At the end of the day, they end up falling sick and spend much money in the hospital. You eat a food and then you go. So it's important. I want you to talk on cholera. Yeah, Faith, I want you to talk on cholera, because cholera, yeah, we don't have cases now. I remember the delegate just removed a communique because some medias came up and said cholera outbreak and all of that, but he came and debunked it that for some time now we've not had cholera cases here in the southwest region, which is good. We thank God for that. But how can we prevent it? Because it's something that when there is an outbreak, it's always sad and disastrous.
Yeah. First of all, with cholera, one way is being transmitted by eating contaminated food. Most of what gets into the body are one of the main causes of why we have some diseases. Because you have a disease, probably it's from what you take into your body. Now, this food, even your food you buy from the market, like I earlier said, you are not sure of where it came from, the mode of transportation till you got to where you are. You're not sure how clean it is. So when you come to the house, you still wash them before preparing. Even when you're preparing, you should ensure that you cook and you cover the food. You don't expose your food outside, because now these flies, and they are vectors, they carry now this bacteria, they land on the food. You left the food open, they leave, you come, you eat that food, you start having running stomach, diarrhea, you're wondering what happened. But because you expose that food and the fly has dropped the bacteria on it, you eat it now and it starts affecting you. So we should ensure that what we eat should be well clean. The water we drink, the water should not be colored. It should not be colored. You should look at the water. That's why it's always advisable that sometimes you're not sure of the water, so you can even boil before you drink. You boil, you put it, cool it.
I was waiting for that part.
Boil the water before drinking. Because most of the water will see, okay, it's snake water, I have snake in my house. You are sure it's snake because it's clean, but you are not really sure. You can even have a filter. After boiling, you put it. You can still filter if you drink. Because anything you're entering your body, it should be well clean and kept well. You should cook food thoroughly. All these things that we cook, even meat, half done, you're tasting, it's not ready. I want to see it's ready, 30 minutes with taste. You're seeing the meat, it's not even looking cooked, it's still red, but you want to still taste it. Those are ways that you are spreading parasitic infections. Yes, so you should ensure that your food is thoroughly cooked. It should be well cooked before you're eating it. Meat in particular, I'm precisely because people like that thing. I want to taste it. Let me see if I know. I want to check it. After 5 minutes, you're there again at the pot. You want to check. Then also, when you leave the toilet, make sure you wash your hand. People have this habit of, okay, let's say people are just from eating, they want to go and defecate. Like we always just say in quote, chop shit. They just eat, they want to go and defecate. Then you are not done eating. You leave the toilet. You just come. You continue eating. They don't even wash their hands with soap. and probably they're eating something that, let's say, potato and arrow, you need to use your fingers. They're in a haste to come and continue their meal. They don't use soap to wash their hand properly. They don't take time. You're not supposed to be in a hurry to do all those things. It's better to take your time, wash your hands, to come and eat something that you are sure of what you're eating, so that you not contract something in the long run. Cholera is very rampant. Yes, people tend to minimize these things. What is it? Washing hands all the time. That man on the diet, as we like to say. So even if I eat it anyhow, I don't wash my hands, I'll not have those things. But in the long run, they start going down with running stomach. You start having diarrhea, you're purging, you're feeling dehydrated. Because when you purge and you have running stomach, you lose water. You go down now with dehydration, you have to now go to the hospital, they start giving you fruit. So why should you go through all that stress when there are things that you can do to prevent it? I mentioned two important things here. Your food, you cook them well, you wash them well. Your fruits, you wash them before eating, and you should have proper good storage methods, how you store your food. You know that if it's something like tomatoes, they easily get bad. Why not even blend it and keep in the fridge? It's easier for you to cook than that they expose it under sun, or you keep it's rotten. Many people go to the market, they'll buy tomatoes, they prefer this cassé, what they call it, because it's much. Then now they are soft, don't know what time eat, and a lot of things they prefer to buy it because it's much, because they'll add the soup will be, the food will be heavy. So instead, by no, go in for something with quality. Take the ones that are still okay, they are not rotten, nothing there. Use those ones and cook. Anything that gets into your system should be properly cooked, water in particular, and all this touching of places. You move around, you go to work, you greet people. In the course of your work, okay, you can go for break time and get something to eat. You are greeting people that day. You are going to eat. Some people have that notion that, okay, they're using a spoon, so there's no need for me to wash my hand. Just by using that spoon like that, it still spreads. We don't see them. So you're holding the spoon, it still uses and it spreads to the spoon, to the food. So you should have that habit, cultivate the habit of always washing your hands. Hand washing is very important. Yes.
I also have a worry. Let me come to before I come to Winner. In schools, especially the nursery and primary schools, at times children go to school, and when they are coming back with one disease or the other. Their method of the drinking water, nowadays it's good. Parents, they buy this water bottle for their children, and which they take and they drink the water throughout the day. Fine. There's another aspect where you have a bucket of drinking water in the classroom. There is a cup there, and each time you're thirsty, you go and get it. I remember when we were going, that's what we saw. I don't know, but there are some places that still practice that. So what's the risk factor?
Thank you for that question. that aspect of keeping a bucket and a cup on it for people to come and for children to come and get
even
water,
people, even anywhere you go, you can see it. Yeah.
For people to come and get water when they are thirsty is not very safe. Reason being that as we walk, we touch places, we touch surfaces. Maybe you enter a car, you greet someone, you open the car, like you are touching the handle of the car. I don't know how many people have touched that handle, what they carry in their hands and so on. Like, for instance, in our society today, you see men urinating on the road, by the roadside. Now, from there, they don't even wash their hands. There's no water around or something. They don't even walk around with sanitizer. So from there, they just leave, and imagine they're coming to drink from that same bucket. They take their hands, their unwashed hands, use the cup, get water, drink, and they keep it back there. You will come, even if you have washed your hands, but the cup is already contaminated, and they also drank from the cup. So you come get that same cup and drink from it. That's you already picking up whatever bacteria that they deposited on the cup. That's not very safe. Another thing is, sometimes those cups are left there, no one actually attends to them. They can be there for a week. I can remember in primary school, they used to say, okay, every Monday is your turn to fetch water, every Tuesday is your turn to fetch water, and so on. So the children just come in the morning, their motive is just to let me go and fetch water before the madam comes. They just go to the tap, they don't care if the bucket was last washed since last week. Sometimes you even find that the cup becomes slimy, the bucket is slimy, and you even look under and you see particles inside. Like, they don't actually take time. Nobody is actually in charge of watching over these things, of ensuring that they're always clean and so on. And then again, people open it, and sometimes you know how people we can be funny. You open and you are talking over it. You are depositing your saliva that contains millions and millions of different bacteria or even viruses, because people carry viruses in their mouth. They deposit some of these things in that water. As they speak over it like that, their spittle falls in the water and it's already contaminated, and someone else comes and drinks from it. So the person is already, just imagine that the person was talking over it had syphilis, for instance, had oral syphilis. The bacteria is already, the virus is already in the water. You drink it and you pick it up from there, and you now start asking yourself where you came from with syphilis, not knowing that it's from that public bucket. Yeah. So.
Okay, thank you. Rina, there's another place, the toilets. If we have toilets everywhere, in this toilet, in our houses, we know this is lunchtime, people are eating, so you mind your words, okay? Don't make somebody to throw up. It's lunchtime. But I just wish people to be cautioned, to know that you can go to a public toilet and pick up 1 or 2 diseases. Is that true?
Very, very true. Okay. Let me start with public toilet. When you want to pee, you say, okay, I want to go and pee. You just go and then try. You sit on it. Or you actually sit on it, and then you pee. It's good. Then after that, you do your things, you continue. But there are actually bacteria. Maybe someone actually came before you. Someone before you came. Some of them try to flush. Others flush halfway. Maybe because they are in a haze, they just flush, or because nobody is looking at them, or because it's not their house, they flush halfway. And others leave their urine there after peeing. Then you come and sit down. You don't know how, because it's looking clean, it's looking shiny, the toilet is looking good. You come and sit down. You've never seen, some of us, we have never seen the toilet before. You come and sit down, you pee, and then you wake up and go. But there are some bacteria there, or microorganisms, as they said, we don't see them. So they are there, but we don't see them. The surface could be clean, yes, but it's there. And then you come, you really get it, you contract it. Then when you go back, you have urinary tract infections. And you're like, where am I getting this from?
Okay.
Or why did I get this? Not knowing is because of maybe one careless mistake, let's put it that way, inhygienic conditions or inhygienic practices in which you took from there. Others, they defecate and don't flush. Or even in pit toilets, most at times you defecate at the mouth, let's put it the mouth, the hole, and then they don't bother, especially these remote areas where they have pit toilets. This is where this risk of cholera can be very rampant, because there are flies. These flies are vectors. Vectors are organisms or insects which carry microorganisms from one place to the other, or from one host to the other. So these flies, now this is what actually promotes the cause of
maybe cholera, maybe malaria,
food infections. So this is good to practice safe toilet hygiene when you pee or you poo, you flush in the toilet. When you finish, yes, nobody is looking at you, but you yourself, your health is looking at you, and have mercy on your health. Make sure you flush. Wash your hands, very important. Wash your hands after you finish in the toilet. Finish using the toilet, wash your hands, and you should dry your hands, because as you're still around that milieu, your hand is wet. So microorganisms find moist surfaces very attractive. They could come back there. So you could wipe your hand with a tissue and discard. Very important. And obey the rules of the toilet, because some toilets, they're like, do not flush tissues. yes, do not flush tissues, put it in this bin, try to obey it, or else you might just pass there because you not come back, but you're causing damage for others who are behind you and who are still coming. So please, let's try to just follow by rules and have a conscience.
We're talking about communicable diseases here, Faith. We talked about bacteria, we talk about viruses. So how can we prevent our kitchen? Because from bacteria, at times you see a whole house is sick. They take this child today, all of them just fall sick at once, and then most of the times when you go to the hospital, you hear the doctor says maybe it's bacterial infection and all of that. How can we prevent our kitchen, that's a powerhouse, from bacteria?
Yeah, with your kitchen, that is where you prepare your meals daily. First of all, where you cook the food, the pots, are they clean? You notice sometimes when you're not used to the pot for a very long time, you see some white spots in it.
Yeah.
So people feel reluctant to wash it. I don't know why. So you start from there where you're supposed to cook the food. You wash the pot, you wash it well, ensure that it is clean. You don't just rinse in, and people are hurriedly do the rinsing and just put the food in it. Even your gas plates, if you're using in the morning kitchen, where you're using your gas cooker, it should be clean. You should clean it with soap and water. This is what I do at home. Before I cook, I clean the gas plate. When I'm done, I still clean the gas plate. It should always be clean, because from that's where you have to cook. You know, ensure that okay, the pot is clean, but the gas plate is not clean. Now, if it is the kitchen outside the house, you should always sweep before you want to cook. When you sweep, make sure if it's dusty, you can put water before you sweep. You clean all those areas. When you're finished from the kitchen, ensure that you always clean the surrounding, clean the surfaces. Then your plates too. There's a way that we wash plates and we just air them. We just put them anyhow. You just expose them. Yes. Some people don't want to put them under the sun, like when they are done washing, they drain it there before putting it. So the container, the basket, or whatever you use to preserve your plates, it should be clean as well. And when you take them, you can still use a clean tissue. You clean the plates before you serve people. The spoons as well. You should ensure that all those things are clean. Then don't forget the windows too. Your windows in the kitchen. From time to time during the dry season, you have to clean the windows, the louvers, because you'll be dusty. You'll be cooking, things are entering and leaving. Make sure that I'm talking in the modern kitchen. Clean your windows too. Take brooms sometime. You wipe even the dust places, the cobwebs up. You clean everywhere to ensure that you're cooking a very good environment where you keep the food. If you're supposed to put it in a dish and you're preserving it, it should be clean. And also, you're putting it in a flask. From time to time, you open that flask. Let's say you're using a saucer or something, a spoon. Let me say for example, you put the rice. Where do you keep that spoon that you use again to put for
on top of the cover and leave it there? Where you come again, you take it again.
It's not supposed to be that way. You have, anyway, in the kitchen you have many cooking spoons, so you can serve that person. You finish, you put it in a dead space, or you just wash at once. Another person come, you serve. It is not good that you will serve someone and you just cover it on the flask. Flies will come and land there. You still come, another person you will just serve. It is not proper. Yes, I've seen in some cases, some restaurants, what some people do is when they serve, they put it in a
plastic and wrap it.
And that is not really a good way though, because you're not so sure of where the wrapping is from and where you're even keeping it. And this habit that people like to talk over food. People are in the restaurant, they are selling. Or you're even at home, there's an occasion, you're talking over the food. Yes, what do you want? There's plantain, there's rice. You're talking over the food, there's plantain, there's rice, everything, the saliva carries the bacteria. You're speaking on the food and you're serving people with it. It is not good. So in the kitchen, you should make sure your gas plate is clean, your pots that you cook, they are clean. Where you serve the food is clean. You clean the floor everywhere, the windows, cobwebs, you move them from time to time.
Thank you. Another aspect before we round up, I wish us to talk to is this aspect of people going to eat roasted fish, roasted chicken, and they make this the pepe that people usually eat with. Most at times people come back home and they fall sick after eating those things. How can we prevent it? I'm coming to you, Joyce.
Okay. If let's say they are getting this running stomach and diarrhea from the pepper, first, let's say the water they used to making the pepper probably is not very clean, and they didn't cook it for long. And as she mentioned the last time, most of these women, they prefer to go buy this cassette water, which is really rotten and there are maggots in it. They just come, they don't wash it well, they just rinse, sharp, and then they just cook. They don't even take their time. And even when they bring it to sell, they just expose it to flies. Some women will even sell this fish. The ones who urinate, they'll just go behind, pam. They urinate and come back without even washing their hands.
Oh,
They just
God.
touch. Some will even blow their kata. Yeah.
It's okay. Thank you.
No, it's reality.
Yes.
It happens.
Yes, it's true.
And
No,
they
go
don't wash
ahead.
their hands and they just touch and serve. So please let's avoid all of these things. And those who are selling, most of these risks come from us. So let's have the conscience to maintain the sanitation, and let's take the people who are selling to as our own and protect them as well.
All right, I have these contributions. This one says, "Hello, Hi TV. Nice program there from very young girls." Okay, thank you. I'm sure you're a guy watching. And he says, most of these restaurants that we go to eat in are very dirty. If you go behind to see where they prepare the food, and even the pot in which the food is prepared, you will not want to eat. So it's a call for all restaurant owners to ensure that they give people good, not just quality food, but healthy food as well. Thank you for sending us your reaction. That's what we are talking about. And also, it's also important. I remember the last time, I think it's almost all of the doctors that I had here in this platform always advise people to eat warm food, especially when you are going to eat at a restaurant, or if you want to buy your roasted fish, like she just we just talked about it, they should heat it, because some of these bacteria cannot stand the heat. So if they heat the food and also heat the pepper, like one doctor was saying that they should heat the food and also heat their own pepper. I was like, I don't know, but if they can do that, it's good. When you are eating hot food, you are sure that it's free from bacteria, it's free from diseases. So make sure you do that, and also make sure that you boil your water, like Iafet said. If you are doubting the source of your water is a big problem in Boya. We have a big problem here. People now a lot of boreholes are around to solve the problem. It's good, but how healthy is that water? Make sure that what you are drinking is good. It's really bad to suffer from some diseases, cholera and all of that, coming from the water or food that we eat. We are rounding up. I'll start with you, Rina. I want you to just summarize everything that you've said and just tell the public, like, okay, I'm sleeping with this now. I'm going to practice it.
Thank you very much, ma'am. Okay, we have heard of communicable diseases. Communicable diseases, big grammar, is just known as infectious diseases. Can be transmitted from one person to the other, or from insects or animals to the other. Now, it is caused by bacteria, viruses, parasites, or fungi. It can be prevented by hand washing, the simplest method, the one which is everywhere. If you're not washing your hands, sanitize your hands. It will save you from a lot hand washing. Then we have vaccination. Most of these have vaccines. Most of these infections have vaccines. Find out and be updated with it. Not that you take a vaccine this today and then maybe rendezvous is after 6 months, you come after a year, or you forget that you took a vaccine and you're like, hey, you took a vaccine. What I do? No. Be updated with your vaccination. Abstinence, very important. Safe sexual practices, very important. And also just practice proper hygiene methods, very important. Proper hygiene habits.
Okay.
Very important.
Amina?
Thank you, ma. Okay, so to add to what Rina has said, we should learn to love each other, because if you love your neighbor, you will be able to take care of yourself. Even if you are sick, you're able to take care of yourself in such a way that the next person does not get infected. If you go to the hospital and you are prescribed medications, it's not all up. There's always this temptation of taking your medications first day, second day, as you feel better, you drop it. So we should avoid that kind of practice. Take your medication till the last day or till the last dose as prescribed by the doctor. Yeah, just then for water, like we were discussing, rather than using a public bucket, we can use filters instead. It's very common in Boya. I walk around and I see people selling filters, water filters. So you can use that instead of using those open public buckets.
All right, and Jocelyn, our miss.
Concerning HIV, a way of protecting it, we spoke mostly only about having protected sex. We didn't mention equipment, like let's say in the hospitals, using syringes. If I prick a person who is infected and I use the same syringe to prick another person, that other person will obviously have a disease. Also, the health practitioners, let's learn how to handle the syringes in a way that will not, after pricking somebody, will not prick ourselves. Or even if you prick yourself first before using it on the other person, don't use it on the patient. And also in barbing salons, the machines we use, it can also be transmitted through that. So let's learn to like get a if it's convenient for you, you get your personal machine and take it to the salon. When they finish shaving, it's sterilized and you come back with it. Even through sharps, blades in the house, I'll finish like trimming my nails, I'll cut my hand somehow, there is blood and the virus is there, and someone else comes and uses it. Obviously you will get it. And please, let's not stigmatize people we know have HIV. Like, oh no, she has HIV, don't touch me, I'll know where your dress is. You can feel free with them, they are okay. Just take them as their own, let them not feel stigmatized. We just need body fluid to be transmitted. So apart from that, let's just be okay with them.
All right, thank you. Your Faith.
Okay, one aspect I would like to highlight more on is safe sexual practices. Yes. If you're indulging in sex, you're not sure of your partner's status, you use condom. Until you're too sure you know this person. In as much as the person looks too healthy, the person can be very healthy, but you don't know the person is carrying. So to protect yourself, you know that you have to indulge in such practices. Use your condoms to just for you don't know, and also get tested regularly for this sexually transmitted infection. Time to time you go to the hospital. So people say I've been 2 years, I'm not been sick, I'm okay, nothing. From time to time go to the hospital to check yourself. Just go. If you want to test for this sexual transmitted infection, you have to get it for malaria, for cholera, because there are some diseases that will just be there low key. But they don't really manifest, but in the long run, if it is chronic now, it comes with manifestation. So from time to time, you test yourself regularly to avoid all these multiple sexual partners. It's possible to stick to one person. Like we said, everybody is a suspect. You are not sure. So even before you are getting into something with somebody, you should be aware of the person's status. Yes. And if you are taking your vaccinations, you follow them on time. There's always a time they schedule they give you. You should make sure you're there. They tell you after 2 months you should be there at that 2 months. There's a reason why they will tell you that you should come here at this particular time. Yes. And also be open to people. Discuss with people about these issues, about their health, and also people that indulge in these practices. Get their own opinions about sexually transmitted infections. So people just see it as it's nothing. It's really nothing. It has no effect on me. I've been sleeping with people from time to time and I'm okay. But let them be aware, let people be aware that these things are actually having a lot of negative consequences on our own self.
All right, thank you very much, Faith. I wish to thank you, Winner, Amina, Jocelyn, and Faith, for educating us, educating the public again this day. Inside the health world. It's really a pleasure to have you people, and also those of you who are watching, those of you who contributed, we say thank you so much. Join us again next week for another edition while stay tuned to High Television.